So good morning, good afternoon, or good evening, whichever is the case, since we are streaming live and we are having this webinar in different time zones with people coming, of course, from all over the world. So my name is Clara Saraiva. I'm in the board and the organizing committee of WCAA, the World Council of Anthropological Associations. And this webinar comes in a series of webinars that WCAA has been organizing. The first one took place in May, in April, the second one in May, and this is the third one now in June. So WCAA, the World Council of Anthropological Associations, as you know, is part of WAU, which is the World Anthropological Union, together with IUAES, the International Union of Anthropological and Ethnological Sciences. So with the theme of inequalities in an era of pandemia, we gathered several colleagues from different countries. We will have from the Philippines, Mary Racelis from the University of the Philippines, Diliman. From India, Nandini Sundar from the Delhi School of Economics, Delhi University. From Russia, Valery Tishkov, I'm hoping I'm saying it correctly, from the Russian State University for the Humanities and the Russian Academy of Sciences. From South Africa, Divine Fu, from the Institute for the Humanities in Africa, University of Cape Town. From Argentina, Mariano Perelman, Instituto de Investigacion Gino, Germani, Universidad de Buenos Aires. And from Canada, Janice from Dalhousie University. So these are all our fellow colleagues, anthropologists, who have somehow, in different ways, worked on the theme of inequalities. And Sundar.
Yeah, hi, I'm really happy to be part of this. And I think what we've all been going through is a period of increasing inequality. If you look at Piketty, both globally and in particular for India, since the 1980s till now, income inequality has been rising, going back to the levels of the 1920s, where you have, the top 0.1% getting more share of the growth than the bottom 50%. So, that entire period from about the 50s to the 80s, where you had nationalization of industries, some form of socialism, has given way since the early 90s to some forms of neoliberalism. And the pandemic, I think, has simply sort of brought out quite starkly the kinds of precarities and inequalities that already existed, and intensified them in a variety of new ways. So, for instance, in India, one of the biggest aspects of inequality has been migrant workers who've been stranded by the stringent lockdown. They were only given 4 hours notice, walking thousands of kilometers home to their villages, because they were out of work, they had no money for rents, they had no food. And so on the one hand, you have this very clear precarity. You have the idea that it's really the village which is what they consider home, which is something that came as a surprise to a lot of people, because there's been so much discussion of urbanization being the new norm and how everybody's, actually an urban aspirant. And the third thing that's really been striking is the kind of indifference of the middle classes. I mean, there've been lots of people who've helped, but at the top levels of government, the kind of callousness and indifference has been quite shocking. So I'm just going to stop there. I think my time is up. Yeah.
All right. So Valery Tishkov, from the Russian Academy of Sciences.
Okay, so I'm going to speak more about equality than inequality, because we have a certain backgrounds inherited from the previous state, USSR, which was quite egalitarian social state, and it's still now we have a situation when no citizens without medical insurance and medical assistance provided for all country residents, including, by the way, migrants. I just today spoke to some of the labor migrants from Tajikistan, and they proved this information. And also the post-Soviet structure was characterized by a tiny sector of so-called new Russians or Novorish people. It's less than 1%, and a pretty sizable, about 5-7% labor migrants. And the rest of population is just more or less relatively well-doing big cities residents and rural area inhabitants. What is interesting for Russia that there is no poverty, urban zones, or also depression regions. Regional socioeconomic disparities exist, especially favoring Moscow and St. Petersburg, and some also resource Siberian regions with gas and oil activities, and also South Russia, excluding the North Caucasus republics. And also when I speak about Siberia, I would exclude also indigenous population settlements, which are not so successful and well-doing. The coronavirus dynamics, we are the third in the number of infective people. It's 600,000 million people were infected. The death rate, mortality rate is over 8,000 people. And 1/3 of infected people are in Moscow. And the dynamic is also characterized that we had a certain time lag, because 2 months after China, it's touched the country, and mainly because of the Russian tourist students, business people returning mainly from Europe. And this epicenter of pandemic wasn't still Moscow. It's about 1/3 of infected, and also 1/4 of people who passed away. And societal responses are quite interesting. We did a lot of sociological surveys. I have it in my presentation, and no time to report of this. But there are regional and ethnic aspects concerning the societal responses. Pandemia statistic is available by regions and by days. It's more or less reliable. And I couldn't actually to establish any correlation between the ethnicity and religious, for example, the Volga regions, where we have regions or republics or federal units with mixed population, predominantly ethnic Russians or non-Russian people, and the data are more or less the same concerning the promille percentage if we will take mortality data. Critical situation took place in 4 or 5 places, including actually the ethnically mixed and very unique territory of Republic of Dagestan and the mountain area in the Northern Caucasus. Peculiarities concerning the Russia, which were working toward the egalitarian type of pandemic character. That is the so-called the dacha phenomena, because about 17-20 millions of land plots which are in possession of the urban dwellers in Russia, and people had a chance to spend the summer, springtime there, and it was psychologically, it was more easy, and also probably it also facilitated, it minimized the level of personal contacts and infections. And also probably a huge and sparsely populated territory, weak communication infrastructure contributed efforts and measures to minimize direct human contacts. And what is also, it's traditional for Russian people, irrespective of ethnicity and religions, a kind of negligence to personal health conditions and a kind of fatalistic attitudes toward life scenarios worked against antivirus measures. But in some, mainly the people were behave pretty loyal, and they demonstrated capability to follow issued orders and restrictions without any riots and mass demonstrations. And any predictions there would be a rise of criminality, especially among the migrants people, were found to be wrong. And volunteers were quite active. And especially what I would say, that is the effectiveness of the medical system. We had a kind of very devoted and professionally quite strong medical hospitals, and the number of beds for infection patients were increased from 40,000 to 220,000 beds. And also military and emergency state agency were helpful, and also built about a dozen of new hospitals. And that's probably one of the reasons why the level of mortality was pretty low, much lower than among other countries which were very strongly affected. What I would say that the crisis made our societies more concerned about strong and legitimate state, a kind of softening between democracies and authoritarian type of governance, and favoring paternalistic modes of government. And crisis demonstrates the need in strong, devoted, and mobilized medical and expert community, and the system of issuing, executing public orders and restrictions. And what is important also, a need in culture of listening experts, because the so corona dissidents were about 15, not more than 20% in the country. Others perceived and understood the situation as a serious crisis. What I would say that people feel failed the international organization, and the nation state with a strong governance looks like a key factors to confront the epidemic crisis. And prevailing, I would say, it's that social strata, religion, and ethnicity were secondary compared with accidental factors and malfunctioning governance. Dagestan happened not because of the Islamic tradition of mass gatherings for funerals or weddings. Actually, it was contributed, but not was 100%, only one reason. The reason was a lack of discipline and ineffective governance, and also low diminished status of medical service in Dagestan, especially in mountain regions. And prevailing popular attitudes towards existential challenges, as well as a state of individual responsibilities, health are probably the only established by my analysis cultural factors which affected dynamic of COVID-19 epidemic. Individual responsibilities for health, and probably it's a lack of this individual responsibilities, one of the characteristics for Russian people. Crisis strengthened phobia against migrants, against travel abroad, suspicion for mass gatherings, and cultural traditions. And I think we should analyze it when the whole data about pandemic would be available. Thank you very much.
So since Mary's not there, we'll keep following the East-West orientation. So now we will have our colleague from South Africa, Divine Fu, from the Institute for the Humanities in Africa, University of Cape Town. Yes.
Hello.
Hello. Okay, I'll turn my micro off so that you have the word. Thank you very much.
Yeah, thank you for the opportunity of speaking, and good afternoon to everyone. I should start with a caveat by saying that I'm not an expert on inequality, and neither am I an expert on the COVID-19. I'm just a commentator on these issues. And I hope that what I contribute will be taken with a pinch of salt. So I'm living in South Africa, but I'm a Cameroonian. So I guess in a way, we have to speak about this country and also about the continent. I mean, generally, the continent at a time when everyone was having very high infections had contributed to global infections about 1% or less, which is a feat given the story of pandemics, on this continent, and given all the predictions that we were going to have a pandemic of biblical, proportions, which really hasn't happened, and we are still waiting, to see happen. But South Africa has really taken leadership, also partly because South Africa is currently holding the chair of the African Union with the South African president. But right now, South Africa accounts for one of the highest infections across the continent. 1.4 million tests conducted, about 110 or 111,000 confirmed infections, about 56,000 recoveries, and about 2,000 deaths or so, which, for a country that has injustice as a kind of a historical wrong, or inequality as a historical injustice, it's quite painful. We know that South Africa itself as a state was created to be an unequal space. It is structured in the DNA of this country, right from the Union State of right up to apartheid, and the ways in which the country itself is founded on dispossession. And that's the history of much of this continent. Whether you talk about Cameroon, whether you talk about Nigeria, the colonial state itself was founded on dispossession and at the same time exploited labor. And I think what we have learned from COVID is that COVID thrives on pre-existing conditions. It thrives on pre-existing conditions on the bodies. It thrives on pre-existing conditions, in specific structures. So South Africa is ranked as one of the most unequal societies in the world. This is a huge challenge, for this government, and every day, and the government, civil society, and individuals try their best to see how to level this. And you can see what this has done, because it then creates a fertile ground for pandemics. We saw with HIV that it was actually the poorest of the poor who suffered most. We are seeing now with COVID-19 that it is the people who are located, in these very poor and disadvantaged communities who also provide care labor, and who do care work and reproductive work, who are actually more infected, by the virus or so. But one should say that the South African state has actually really invested much. We have the toughest lockdown. We have experienced the toughest lockdown on the continent, one of the toughest lockdowns in the world so far. We are beginning to ease a lockdown in phases. We are now in level 3 of the lockdown. And I think by the end of this month, we'll be slowly moving back, into the economy. But what we're experiencing is that it is thriving on an inequality that has structured the society, for many years. It's not a surprise that Piketty starts his book, Inequality in the 21st Century, with South Africa as an example, with Marikana, and the kinds of inequalities that led to that violence. So I would end there for now.
Okay, thank you so much, Divine, for your intervention. We will now move on to Argentina. Mariano Perelman, Instituto de Investigacion Gino Germani, Universidad de Buenos Aires. Mariano.
I am also a researcher of the Argentinian National Council, CONICET. Thank you very much for the invitation. And when I got these questions, I started thinking and I realized how difficult it is to talk about inequalities. We are doing well in Argentina because epidemiologically way of speaking, we are doing well. We have 50,000 confirmed cases and 1,000 dead only. So compared with Brazil, our neighbors, that has the same numbers but per day. So in that thing, yes, we have a very also hard isolation. We are here isolated for 90 days. I'm at home, I cannot go out home, only to buy food and that stuff. So it is being hard. And I said that this, the complexity of thinking about inequalities is because we may agree that there are many dimensions of inequalities. So, and there are some opposed tendencies also to think about inequalities. So it is hard to say and to characterize Argentinian case. I start thinking about these proportions, and what I start thinking it's about how there is a myth here about Argentina being an European country, and as a myth, it's not real or false. It has its effects, and this goes with an interesting thing about inequalities is the denial of, for instance, native people here, black skinned people. The history of these people is denied. The way of their living is denied. So that's one core interesting of inequalities here. It says that Argentinians came from the boats, no? That's the idea. There are some inequalities produced from this racism, and also there is a structural interesting differentiation between the center, Buenos Aires city, and the interior of the country. So there is Buenos Aires and the rest of the city. This is an inequality of wealth, but also the way of different ways of living are evaluated. So, for instance, in the interior, we are called the people, the negros, the black. That this is not a thing of skin color, but it's a way of saying that this construction difference between the civilization and the rest of the city. So also the gender issue, it's important here as in all countries, and urban inequalities that are what I deal with. So how this was, I'm getting out of time. I'm nervous because of that. How pandemic works within these inequalities, it's interesting to understand. For as it's I love this idea because it's showing that there is no one pandemic, but there are many pandemics here, or how we can construct the idea of pandemic. Not only as a global, but also as a regional and local thing. What I'm trying to say is that we can understand the pandemic effects or the pandemic by thinking about this, what Divine said about the persistent conditions, but also how this discourses works in our countries. So regarding to inequalities now and pandemic, for instance, we have more native people are living worse than before because they have no access to health distance. Urban inequalities are getting worse. It is interesting to say that, for instance, the pandemic started in the richest part of the city, and now there are more cases in the poorest part of the cities. because of isolations, the measures of isolations are hard to establish in different houses and neighborhoods. For instance, it's not the same to be at home with water, with space to be isolated, than to live in slums in one room, living 5 people with no water. So it is hard, this difference. But also there are some paradox, and I will finish with that because I'm out of time. For instance, in Buenos Aires, we're still in strong isolations, while the other province of Argentina are getting out of this isolation because conditions are, the 90% of the cases are in Buenos Aires. So, and also, there are some way of understanding inequalities, not in these macro levels, but in the micro levels, in interactions, and for instance, how police treat the people who do not respect the pandemic, the measures. For instance, it's not the same to not to stay at home in slums, and maybe there are repressive measures to that people than in the neighborhoods of the center of the city that are more allowed. Okay, I'm out of time, then we can continue discussing. Thank you.
So inequity has come in many diverse shapes, sizes, and colors in Canada, and COVID-19 has released the genies of race, class, and gender from the bottle. As my colleague Charles Menzies tweeted last week, the color of the boardroom is capitalist, and the test of a government getting re-elected, it seems, is to manage that and to keep the public from getting too upset. The COVID-19 pandemic has released the harmony of illusions, as Alan Young has called other things, and SARS-CoV-2 is not really an equal opportunity pathogen. In the real world, COVID-19 is a Pandora's box of signs and symptoms of organs and health and social system breakdowns, historical, political, and economic determinants that underlie the sickness manifested in this pandemic, and the growth industries that are inevitably forming to capitalize on its futures are firmly rooted in precarious labor, systemic racism, and gender inequalities, ageism, as much as they are accelerated by global mobilities and global warming. Crowded wet markets, opportunistic zoonotic leaps. A pathogen can easily catch a flight to the next business meeting, another financial opportunity, the decision to leave borders open to save an imaginary financial economy that seems to be benefiting far fewer than the people laboring in it. Far fewer, it's benefiting far few, but the people laboring in it may not be seeing it very much. And that's going to be subject for future critical analyses, I hope. The wealthy can afford care and they can replace their caregivers when they get sick. The privileged can work from home while collecting their wages and benefits. They can order in gourmet meals and do Zoom fitness workouts, and they can garden, and some even go for a swim in their backyard pool when the parks have been closed. Precarious workers, on the other hand, are often immigrant, the homeless, the institutionalized elderly, the immunocompromised, and those living with mental illnesses, not so much. SARS-CoV-2 is not really an equal opportunity pathogen. Those lacking education, employment, and good health for a multitude of structural circumstances also lack the economic buffers that have protected others. As of yesterday, over 102,000 Canadians have been diagnosed with coronavirus. We are a population of about 38 million, almost 2.5 million have been tested, and 3.8% of those have been found to be positive. Importantly, it's the institutionalized elderly that constitute the vast majority, fully 80% of the 8,500 deaths. These facilities have been knowingly underfunded for years, allowed various shades of privatization to creep in like wormwood rot. The board of directors of these facilities are made up of leading members of our society, some politicians, and even former premiers, the most notorious collecting $250,000 in compensation a year for his volunteerism. The worst homes for the elderly crowded 4 seniors to a single room and left active cases in the same rooms as the still uninfected. The Canadian Army had to be called in to help residents left neglected in their own excrement and without food because the staff were too sick to come to work. precarious staff working part-time for minimum wage so management could avoid, let's face it, legally get away with paying their workers livable wages with benefits, with benefits. So we've had this whole situation of often creeping in as American companies, these long-term care facilities for profit. These caregivers were shuttling between jobs in several facilities to afford to live. For long-term care for the elderly from these long-term care for the elderly to sites of largely immigrant and migrant labor, first meatpacking plants, now farms. SARS-CoV-2 is no equal opportunity sickness in Canada. Essential workers became the mainstay of our society, from those working in grocery stores to garbage pickup. Some healthcare workers, the medical professionals, and unionized workers continued to be remunerated well. Others received temporary top-ups as frontline workers that is now quickly being clawed back as wave 2 comes to an end. Canada's colonial history through the present is ripe with systemic racism. Indigenous peoples comprise 5% of our population. Okay, until 1985, Indigenous women lost their Indian status if they married a non-Indigenous man. Indigenous people have had the lowest rates of education, highest rates of food insecurity, diabetes, heart disease, tuberculosis, and respiratory illness in the country. Indigenous children are 3 or 4. What I'm trying to sort of state here is that we have our own brands of inequities in Canada. They've been addressed through various systems. They're being addressed by various national commissions, like the Truth and Reconciliation Commission, for good or bad. There's very stated racial and ethnic vulnerabilities. There's been enormous collateral damage with COVID. So people that aren't dying from COVID because our public healthcare system responds to everybody equally, and it really does. And this is the difference with our neighbors to the south. Underneath the wounds, underneath COVID-19, are all sorts of not necessarily reachable people. And in Vancouver's downtown east side, for example, there have been astronomically increase in overdose deaths, and in all of those interstices that creep in underneath other forms of inequities. Our communities have felt less safe. Fully 60% of Chinese Canadians polled at the beginning of wave 1 have acknowledged adjusting their routines to avoid racist run-ins. And the extent of intersectional inequities was evident when an Indigenous woman in Vancouver's East Side, mistakenly identified as ethnically Asian, was beat up and told to go back to her own country. Racialization of those of apparent Asian ethnicity during the initial phase of the pandemic was palpable, and time will tell whether that continued as the waves move forward. Black lives mattered too in Canada, but just not the same, arriving in the 17th century as slaves to European settlers, and later as Black loyalists. Black African Canadians made their way north to Nova Scotia, or African Americans made their way north to Nova Scotia during the American or after the American Revolution, promised freedom and land. But as my colleague Ingrid Waldron has shown, these free men and women were soon dispossessed of that land, and Indigenous and Black communities have suffered systemic environmental racism in the ensuing centuries. In the first days of the provincial COVID lockdown here, our premier faced public backlash for singling out some African Nova Scotian communities as people who do not listen and won't stop partying. He said this 2 months ago. Prominent African Nova Scotians, such as Senator Wanda Thomas Bernard, were quick to respond with concern about the high rates of COVID-19 in their communities. We know that racism is a social determinant of health, but it's not identified as such, she said. It's not just in the suggestion that we weren't following the public health guidelines around social physical distancing, but the tone that it was used, the language that was used, and the way that it was represented. And so there was major pushback against this incredibly racist comment from our premier. Other groups organized and came together. Halifax is out of the cold emergency shelter, and the Mi'kmaq Native Friendship Center partnered with a downtown hotel in mid-March to house approximately 15 people experiencing homelessness during the beginnings of wave 1. Such a move, and it's still cold here in March, really cold. So such a move afforded our citizens a safe, healthy, and dignified living arrangement during the pandemic. Other shelters followed this model shortly after, funded primarily by federal dollars. And Canada's federal government stepped up with billions of dollars to support Canadians, emergency response benefits, direct support programs for essential workers, students, seniors, the homeless, and mentally ill. Deferred tax payments and a plethora of funds and credits were offered to businesses. Unprecedented millions were made available for COVID research, and quick legislation was rolled out to assuage the fears of inequitable access to emerging health technologies that are being funded. And to that end, the COVID-19 Emergency Response Act was promptly enacted in March to appropriate any patented discovery, therapy, or vaccine as needed to address a public health emergency. So very different from countries where vaccine nationalism has been put up on display as strength. It was immediately topped and addressed by our government, who said that any vaccines produced with Canadian monies should be made available based on need. I think I'm probably running out of time, and I can come back to this in the second round. Thank you very much.
Okay. Thank you very much, Janice, for your input. I will now, last but not least, we will finally go to our colleague from the Philippines, Mary Racelis.
I haven't heard the discussion, but I'm sure we can all agree that definitely inequality has been brought out very much by this COVID. It's always been there. We've struggled against it for a long time, but now it's so obvious. And even the wealthy have to take a look at it because they were also affected, since we know that the virus goes throughout the society. Let me concentrate on the urban poor, because that's really where I do most of my own research, and I work a lot with NGOs on the ground and the people's organizations. And one of the first things that I discovered when I called up the leader friends, most of the leaders are women in these urban informal settlements. So I called them up and asked, what's happening, how are you doing, and so on. So they began to tell me the stories of what's going on. And one thing very clear was the government had framed this, of course, as a health emergency. And they were mobilizing to deal with it that way. For the urban poor communities, the crisis, this is another crisis. Every day is a crisis for them in a way. But this is another crisis. But what the crisis that faced them was the lockdown. They were not thinking at the beginning, at least, of the COVID, the pandemic itself. They heard about it. Many of them were dubious about it, just another form of flu. But what they did know and what they did frame as their issues was the lockdown and how it virtually stopped economic activity. And as I think probably our friend from India spoke, or Argentina, it meant that overnight, they didn't have any time to prepare. And so those who earn every day, on an everyday basis, were really stuck, shall we say, or in really bad shape. And they framed the problem as hunger. How am I going to feed my children? So meanwhile, while the government, as you know, we have a somewhat authoritarian government, they framed the problem as a security problem, just as they did the drug problem. This is a security problem. You have to control the population so they don't wander off and spread this disease. And therefore, the interagency task force, which was developed under the president, is mainly, aside from department secretaries, a lot of military people, and almost all men, I think. And so they became the force which manages this whole process. So at the community level, even though we as anthropologists know how resilient, how active people are, especially when they organize. And in the Philippines, in Manila, certainly, people's organizations are very strong. and NGOs help in that organizing process. And they've made many demands, made successes here and there, anti-eviction and so on, better resources, and adamantly staying in place. They're not moving. That's another whole saga. But the organizing is strong, women very much at the head of these organizations, and they're quite willing to speak out. Women feel they have more possibility of speaking out than males, especially when you have a militarized type of situation. And so for an anthropologist to see how the realities of communities, the struggles, the arguments between them, but also the vitality and kind of a shared value under an emergency situation, a shared value that, okay, I have to get my household's food allotments because government had to provide that. So they became totally dependent on government and on the good feelings of better off people, church-based people, and just NGOs, and ordinary people who wanted to help knew that they were in dire circumstances. But the problem was, from the community side, after they got their household's allocation, there were arguments about that. Often they would share it with their neighbors, with the people in their own sitios or their own, certainly in their organizations, if not everybody got the same share. I mean, that value that you have to care about one another, which is always there, but it gets heightened when you have this kind of food short situation was there. And yet government basically, it's hard to draw, anyway, government basically does not recognize or pay attention to or value the vitality of communities, which is a very sad thing to say. Okay, so there they were, just like in Argentina, locked in small places, couldn't move out, dependent now on government or benefactors from the outside or NGOs who brought in food and so on. The effects, of course, maybe we've all spoken already. I mean, children are out of school, and when poor children are out of school, the chances that they'll go back are much less than before, especially now if online becomes essential. How are they going to ever catch up? I mean, government education is trying to do something about it, but we know that many of the children will not ever have access to the kinds of online equipment you need, right, and the training you need. So education for children, which was really the family's way of moving up. We did many, many chats with people in communities where the parents say, my life is my life. We live in the city because we are trying to move up a little here and there, and they do. But if my children can at least finish high school, even college, then we're in good shape. Then I can be satisfied, because then the eldest will bring the younger brothers and sisters to school, will take care of us in our old age. All of that is now going to be gone, or at least very much undermined. So the poverty of the next generation is going to be facilitated because of this situation that they now all face. Food, of course, for nutrition, we can see that's sort of obvious, especially for children. So this lockdown has had very severe effects. The fact that as people begin to get anxious and try to go out in order to work somehow and get arrested, because the police and the military are always around informal settlements, they see them as dangerous, then again, you can see the dynamic where urban poor communities, get less and less voices, fewer and fewer voices or places where they can speak out without appearing to be criticizing the government. So let me just say that, all right, the strength of the communities, we hope, we are trying to get across somehow that the terrible situation, we are not doing well in the Philippines on incidents and cases and deaths and so on, compared to Thailand, our other Southeast Asian neighbors, compared to Vietnam, which they got into this early on, and they relied very much on a primary healthcare system that was working, which in our case has sort of disappeared some years ago. So building up communities again would be one way, except if you have a set of authorities who really don't have much faith or trust in many of the poor, and the poor basically have lost, in many cases, trust in government. And we know that trust in governance is a basic feature for overcoming COVID with the population. So I guess the last thing, I would say there is the urban poor who are already poor, many of them already in crisis situations, fluctuating up and down. Of course, that's reinforced, more dependent, different parts of the communities affected, as we know, women, violence against women. The military, the police report that the incidence of rape dropped by half compared to last year at the same time. But other groups that have studied this and by calling up people say, no, it's happened more, except that it's not reported now because the police have enough to do. They don't want to bother with, household problems. So all of that is, coming out and has to be seen. Poverty has been heightened. That's what we can say. And how long it will last, whether it's heightened and extended long into the future. And so I guess, here's the final thing I want to say. Many of us who are in the social sector especially are saying you need some kind of transformation of society, less income disparity, but how do you do that? As sociologists, anthropologists, psychologists, how do we do that? What are the specific things that can be done so that you get really structural kinds of changes? And one thing that often occurs to me, which I say to my middle and upper class friends is, if you don't pay attention to the income disparities and the levels of poverty in this country, now COVID has shown it. There will be another pandemic for sure in 10, 20 years maybe. But it'll affect you also and your children. So it is in your own interest, you better off people, to pay attention, and you have power in government, get to know people on a personal level. We can facilitate that, those of us who work at grassroots level. So you see them as people, not as problems, which in many cases, of course, the outside sees them. So it requires a change in attitudes, in behavior, and in a concept of what is a correct society, what is a fair society, what is an equitable society. And that's where we are now. So thank you.
From the beginning. So I think that some of the themes or sub-themes that have come up on the chat are exactly some of the ones that have come up in previous seminars and previous webinars also. The problem of domestic violence and gender inequalities, the problem, of course, of socioeconomic levels and inequalities, and also something that I reckon it is quite important and has been raised, from people in the US, from Canada, also from Argentina, and by Carmen in Brazil, which is the direct connection with government. Of course, all the participants have been mentioning this, the problem, the question or the issue of the direct connection between policies taken to face this pandemia and the political options of each country.
So I think what we're seeing from, hearing from all the speakers is that there's a kind of coming together or overlapping of three distinct kinds of inequalities. One is the existing long-term inequality, both in terms of work, in terms of gender relations, in terms of power that has been, that have been structurally underpinning the kinds of societies that we have. The second is the kind of inequality that has been created by COVID, in itself, which we see manifested in terms of inequalities of state provision. So the inequalities that are created by differential infrastructure, differential access to nationalized health, the way that different states have handled it, as well as the inequalities of, age, for instance. So clearly, comorbidities being a big issue for the elderly or people who, are otherwise in difficult living conditions. The third kind of inequality, which we see very strongly, both, Mary talked about it in the Philippines and in India, as well as in South Africa, is the inequality created by the lockdown. And that's been a huge ongoing crisis that we're going to see in the next few years playing out. And I think what these three different types of inequalities bring together is also an understanding of the kind of inequality that we have in imagination, in empathy, and in who has the right to feel. Because in a way, the fear of the middle classes or the elite about getting sick is something that they can afford to fear, whereas the poor, who are also equally concerned about getting sick, are not, in a sense, allowed to have this fear because they're so worried about starving. So there is a whole inequality in the kinds of emotions that people are taught to have, expected to have. There's an inequality of resistance because what we see with countries like India, which have authoritarian governments, is that rather than the pandemic providing a space for envisioning alternative futures, thinking of situations where you can have more local communities growing things locally, producing things locally, greater altruism, what we're seeing is a rise in authoritarianism, both data surveillance in the name of health management. So we have the Indian government pushing this app where they will, record your location, record everything about you, among, adding to existing data surveillance problems. You have extractive, licenses being given for extractive industries in dense forest areas. You have a complete relaxation of labor laws. So there's been a kind of huge push towards the more authoritarian aspects of governance, apart from the criminalization of dissent. So even as you have COVID going on, more and more people are being put into jail for all sorts of protests that happened before COVID. So you have, on the one hand, people needing to think of alternatives because of the situation that COVID has thrown up. And you have the government resorting to the same old extractive anti-labor policies and justifying it with the help of COVID. So I think we're going to see going ahead a kind of battle both of ideologies as well as the need to assert the right to have basic human dignity, the right to have basic security of health, of conditions, regardless of who you are. So I think universal basic income is, but it depends on how many people are going to be alive to fight these, or how many people are going to be out of jail fighting these issues in a country like India.
There was one question to me on the chart. That it was mentioned a large-scale gathering. I mean, the military parade yesterday on the Red Square in Moscow. Actually, the coming Sunday or weekend, the 1st of July, there also will be all Russia referendum on constitutional amendments. And also there is a risk of more people can get infection. But concerning the parade and also other events yesterday, including the state prizes in science, which took place in Moscow, in Kremlin, and my friend Andrei Golovnev, anthropologist, got this highest prize in science and technology. But he was for 2 weeks ahead. He was asked to come here and to reside in a special resort place, completely isolated. And he was isolated for 2 weeks with all these veterans who were sitting on this on the Red Square, and who were communicated with the President Putin and other officials. So far I understand there were a lot of precautions has been done, and also testing. We tested 16 million people in the country, and that was one of the important peculiar feature of the pandemic. Yes, there was a risk, but the political will of the government and of the president, I think, was present there, and a certain risk, from my point of view, had place, and we will see, I mean, a week later how it affected that's one of the reasons why in my presentation I told that transparency issue and my belief in statistics was more or less reliable till the point when this military parade took place yesterday. It surely could influence, political factor could influence the politics of transparency concerning the coronavirus statistics. That was my answer to this question. And I also want to say, when we discuss the phenomenon of inequality, probably we should also mention not only unprivileged section of our society, but also people who privileged, not only poor, but also rich. And that's an interesting phenomenon concerning the extremely rich people in our country. I mentioned it's less than 1%, and they had a unique chance to hide himself in some resort places, which are carefully guarded and also selectively supplied. And it would be interesting to see what is the level of the infection took place among the high-ranking people, because we know that even the head of our government, Mr. Mishustin, got a COVID, and he went through this disease. But that is how the virus actually cross ethnic and social and racial borders. That is also an interesting phenomenon. Can people with resources and with rich, with big money, can really hide them from that challenge or not?
Muggsy has been responding to the questions he posed, which makes it even easier to respond to. Yeah, but I should start by emphasizing what I indicated earlier, that pre-existing conditions, the framework through which one should understand this virus and its consequences. Because, I mean, the way we are trying to deal with the virus and its consequences is to be able to mitigate, people who are vulnerable or made vulnerable by these pre-existing conditions. And for the case of South Africa, this is really, really true. I mean, South Africa is a society that is unequal across racial lines, and a country of close to 60 million and perhaps 61 million people, 75% of that population being Black, and 9% or so of that population being white, and then the rest, within the other percentage, you have over 80% of the wealth in the hands of less than 10 or 10% or less. And you can see the consequences of this. This is not just South Africa, specific to South Africa. We can see this in Brazil. We are seeing this in the US. We are seeing this in France, in many other countries. We are beginning to see that some of these issues that we thought were very exclusive about this space are issues that we can find globally. And it's not surprising that, right now, to respond to Muggsy's question, that it is Black people who are most affected and infected. These are spaces with intensity of relationships, which a friend of mine, Parfait Akana, has called promiscuity. That relationships are so intense, conviviality is so intense, that the best way to describe it is to use the term promiscuous. And you can see that all these measures, such as locking down, social distancing, these are things that are very specific of spaces. Every time I listen to the WHO present and tell, when you're sick, you should, if you're living in a home, you should make sure that you choose a section of the home where you can isolate someone, and ensure that you stay away from this. I mean, how do you isolate, when you live in 2 square meters or 3 square meters, when you have lots of people living with that context? And as Shilbembe has indicated lately, in many of these contexts, like South Africa, like Cameroon, lots of these ordinary people live through mobility across the city, through hawking, through selling, through trading. And when you ask people to lock down, you know, you take away some of the basic means of survival, you know, for people, you know, within these countries. And as someone had posed, when you compare South Africa's lockdown measures, you know, to that of many other countries on the continent, many others had to deal with this issue. You know, how do you lock down a country where intensity of relationships, you know, are very high? You know, where people are constantly connected, where these connections are the main means of survival. You know, in these spaces. So we think the government, at least I think the government, the South African government, has been really proactive, you know, in trying to mitigate the consequences of this. Of course, there's always more that should be done. And in this country, we've seen civil society, you know, show up. We've seen individuals, you know, make contributions. I mean, we've seen lots and lots of collaborations or humanity or humaneness, you know, shown to support and help people. But again, because we have pre-existing conditions, you know, we structure living in this space, and the virus has just exacerbated some of those. While violence might have, crime might have dropped, but you see an increase in, you know, gender-based violence. But it's not just South Africa. We see it in the US. We see people reporting, you know, across the world. So while there are things that are specific about South Africa, I think it's important to connect those globally. And just to say one last thing, which I was reading Mugs's comment. I think there is an assumption about this continent that it's just incompetent. You know, every time there is a crisis, this continent is always framed as a place that is incompetent, you know. And if you look at what this continent has been able to do within the context of this virus, I think there is something to be said about the work that governments have put in place, given the meager resources that they have at their disposal. You know, the Africa Center for Disease Control, for example, has been able to connect many countries, reporting at a time when many regional bodies and regional collaborations have collapsed. Look at Europe. When Italy came to the doorsteps of the European Union and others, you closed your borders. You know, we've seen leadership, you know, on this continent, and it is something, you know, to acknowledge. And this is not to deny the consequences, you know, and also the shortcomings that governments, you know, are demonstrating.
Lockdown. So next speaker is Mariano again. Mariano from Argentina. So I think he wants to expand on this theme of poverty versus middle class. So please, Mariano, gracias.
Yeah, thank you. I was trying to write there, and it was my turn also. I have other questions also of Carmen, I believe, that asked me about the perception of the president and president actions in Argentina. Let me try to organize this, put my speech now regarding also to one question, Clara, you put for us is what anthropologists can we learn, can we do, or must do about this? And first, I believe that we should think what a pandemic is. So that's because we are now thinking about this question about Virginia put, if the effects of the lockdown will be worse than the effects of the pandemic, as if these two things were not the same thing. But I believe that are part of the same thing, and we should go that way. Here in Argentina, but also make us to think about these different regimes of values, about what is worse and what should we defend. Here in Argentina, regarding to also to Carmen's question, the president, when we start these actions that start quite quickly here, as in South Africa, as in New Zealand, as I was reading, because we have only, let me think, that 100 cases when this started and only 3 dead. And we got a completely locked down. We are isolated since then, 3 months ago, and we have 50,000 cases now and 100 dead, as I said. So my question here is, what is success? What does it mean that? What regimes of values are we protecting now? The president of Argentina said here, when this starts from a recession, you come back, but you don't come back from death. So that started the discussion between economists and epidemiologists. And well, that's a thing that we as anthropologists must take care of, thinking about these regimes of values. That also goes with the idea of success. And I believe that the cases of New Zealand and Argentina, why the same measure can work in one country and not in another, we will have a lot to do with that. So the perception of the president that Carmen in Argentina started like for the 80% of approval, now it's in 60% because people are getting tired of being home, and also because the economy is getting worse. And as I agree with Nandini and Divine in the interventions about how these people live and how difficult it is to live in different conditions. Also because, as Carmen put it out, domestic violence and other kinds of violence against women are increasing now. So one measure that equals makes some make difference between different groups more equal are increasing other inequalities. That was my point, one of my points. The other point is to point out and talk about what Virginia said. If we are talking about poverty, I don't believe that. I believe that it's even more complex, because we must start thinking about, that's my idea, about these regimes of value, about what is worth living and why, and that's important thinking about inequalities. What I'm trying to say is, for instance, when I try to make my point about people in the interior and people in the city of Buenos Aires and how they live and how they put way of living as a legitimate way of living, that we are playing in all that stuff, in which values are more likely to be protected now. So that goes also with my idea of that pandemic is not only one that is global, but is local also, and we should start thinking about these effects and what Divine, I don't know how to say it, sorry, say that its root, pandemic's root in local inequalities, but also in local legitimacy's way of living that has to do with inequalities. So I believe that the end of the road, biological life, it's important, it's the end of the life, but what happened in all this process that we are analyzing, and maybe we should go that way, and we should intervene in the public debate in this understanding, in this way of understanding, because effects of the pandemics are rooted in local inequalities, but also actions could be performed because or in this way. It's not the same as it was said that we can be isolated at middle classes home, that in poorer houses. It's not the same. People, for instance, in New Zealand say, well, why does it work there? It's only because government actions, or because also people's perceptions of these actions, and what should we protect? That's interesting. I believe that we should discuss, because here it has been a lot of protest against government actions, but these actions that use the virus are not only because of the virus, but also because different political ideas that were before the the pandemic, and now are re-expressed or expressed in another way, interchanged with this new situation. Well, I hope I try to make my point a little more clear. I got out of time. Thank you.
I was sort of to sum up things going on here and put it in these lines of equity. I would say that in terms of systems and institutions, Canada's public health care system and social safety net has in fact served many, many people quite well under the guidance of a civil society who has acted in the interstices of the gaps. Any Canadian can seek public health care at no cost, and newcomers without citizenship can do that, the poor can do that, the mentally ill can do that. Anyone can be tested, but anyone would receive treatment, or if there were any treatments, and as well as care. So the work of finding the vulnerable, though, and the disenfranchised started immediately here. Canada isn't perfect, and I pointed that out. And but in many respects, community is still valued, and our healthcare system ensures that anyone who meets the medical criteria could be tested, and that's taking place right now. And once counted, they're looked after as best as possible. Another thing that was really interesting to follow here, and for me, is the leadership and how science really trumps politics in Canada. It was our scientists, our public health officer, Teresa Tam, and our provincial medical officers of health who told Canadians on a daily basis how their hospitals and public health system would serve them during the crisis, and how they could seek emergency help in their communities when the hospitals were largely closed down. They were closed down, but people could still get medical attention either virtually or in little sort of standoff clinics. The Prime Minister, whose wife was among the first to be infected, self-isolated in front of the entire country. He self-isolated, but daily came out very transparently, walked out of his house, stood, many feet away from the reporters and the cameras, and reported the latest scientific public health information that was going on. And never want to miss a drama and a political opportunity. He also used that as an opportunity to start rolling out money, lots and lots of money. And every day he offered something to different groups. So in a way, he captured the Canadian population, because they were wondering if they were going to be in the next kind of like benefit package. These talks were science evidence-based. The public health approved statements were very clearly backed by the provincial and the national medical officers of health. The public programs that were divvied out day after day involved wage relief and benefits that kept everybody interested. Care was taken to include all sorts of communities, the vulnerable, the homeless, researchers, and of course, lots and lots for businesses and banks. I mean, this is a liberal government. The serial, which here means they're not really, we aren't socialists, they aren't socialists. Many of us are, but they aren't. The serial routine drama made really excellent entertainment. Really, Canadians remain a skeptical lot. Few believe everything that comes from a politician's mouth, but our governments, both the federal and provincial governments, were clearly being advised by experts in public health. And when they got it wrong, people had the scientific literacy to understand that a new pathogen meant that this was new information and no one could foresee the future. Not many Canadians believe in angels, but they do believe in peace, order, and good government. And I was really, that took me aback, actually. These are like kind of mum and apple pie statements, of sort of a colonial, post-colonial empire, but it really seemed to play out, though far from perfectly. And this is where the civil groups and social activists and all sorts of communities came in to fill in those gaps. few Canadians think their political leaders are infallible, and if they piss them off, we vote them out. At least that's worked so far.
The miserable environment, which is typical of urban slums, but the fact that people are, living there and trying to make a better life. It'll show people doing their own, flood control of their own. They make those decisions and they decide, they raise funds for it. The women organize ways of earning more income. So those are some of the pictures you'll see. Protests, which in this case, this is a Catholic country by and large. The protests are couched in the religious symbolism, right? Oh, this is, here's, the kids get in on this, they're in on everything early. Just flash it very quickly. I do not need to discuss this. Can we just go through very fast? If it's too much of a problem, you can just skip it and we'll, here's the environment, but the hope is that if this child can get through high school at least and college, that family has a future and so do the siblings, right? And that's kind of the main avenue for upward social mobility, if you want to call it, in the urban poor communities. Again, examples here, they connect with NGOs who provide these materials, waste materials, and then they have technical people who teach them how to weave these things, and then they're sold in a kind of fancy market, so they make some profit. Just by being organized, they work out ways in which they can improve their situation. Here's where they were fixing the flood control. And you can see the kids are always around. So the socialization from childhood is there in those lives. And what do these children aspire to? Mostly we see the boys want to be policemen, big truck drivers. The girls want to be nurses and teachers because those are the people they know. But meanwhile, and this is where NGOs have come in to help mobilize, do organizing. Let's see next. Yeah, so here again, the environment and what they have been saying for years is slum upgrading. Instead of throwing people out to resettle them out into distant places outside the city, which they have done, hundreds of thousands of families, on the excuse or rationale that they're in flooded areas, which they've been for many, many years. They know how to deal with it. But when they get placed in actually houses with some tenure security, they find they can't survive there because there are no jobs. They're too far out of the city. The transport is too high to come back in, etc. So very misplaced projects, in some cases. So let me just get then, maybe we can just skip the rest of the slides and so I can concentrate that. You asked, what can anthropologists do? One thing we can do, I think, is frame the problem from the perspectives of the people who have the problems. And those are the people we usually, as anthropologists, talk to and so on. And when you work with NGOs that work with them, you really get into what some of us call engaged anthropology. That is, that you get committed to fostering their, especially information needs, and helping them formulate the issues in ways that they can put it into some kind of proposal to the government as an alternative to what the government wants to do, say vis-a-vis housing, or how costly all of that is. So we can, I think, be very supportive there. We're not activists in the sense that an NGO would be, because we're evidence-based activists, and that's an important distinction, I think. To keep our credibility, I mean, if those of us who are based in universities, like I am, you have to do the standard things that anthropologists, they write in good journals, they give talks and, this and that and conferences. You have to maintain your credibility as an anthropologist, which will enable you to do the kind of work supporting communities. And they call you an activist, but you show that your particular role is providing the kind of evidence that people decide they need. Not so much that we want to do research about them, but it's really a partnership in an action, participatory action type process. And just to give you an example of this reframing, not so long ago, a month ago or so, this interagency task force announced that this COVID has shown that it's very difficult to deal with it because of the congestion in urban slums. All right, and to solve that, at least begin to solve it, people have to go back to the provinces that they came from, have to encourage them. They did say voluntarily, right? And they know that they have to improve the situation in the rural areas to make them stay, because in earlier program, they all came back. But that notion that the poor are to blame for the sustaining of this spread of this COVID, that was their framework, government framework. The organized urban communities, together with NGO supporters and some of us academics, brought out that congestion is exactly what they have been complaining about for years. So agreed, congestion is a big problem. But the answer is to improve housing, either on-site upgrading, tenure security, or nearby relocation in the city with decent housing, which is affordable. And so the urban poor now have put together a manifesto in which they say, you know, the government is trying to get off the hook to deal with the realities of the needs of the urban poor by saying, one, they're the problem, two, therefore, they should go back to the province. Never mind, of course, the rural poor who are still there and how they will be affected. And the problem of, are you going to take COVID back to the province, which actually has been happening, because they started this program, although mainly they're trying to get back those who got stranded in Manila, go back home, the overseas workers who have come back from the Middle East mostly, who have to get home. And they are now bringing, even though they're supposed to be examinations, testing, doesn't always work. And they go back to the province, and provinces which never had any COVID now are beginning to see it, partly because of these entries. So, you know, so anthropologists, I think, have to come out and be very clear on what are alternative frameworks for looking at the realities ahead, right? And just the last thing is, okay, what are some solutions? One of the things we're trying to work on is reallocate the budget, take another look at the budget of the government. Let's put less, you know, the Department of Public Highways has huge amounts of money to do what's called the Build program, massive construction of bridges and roads, a lot of them in Metro Manila, some in the other cities, but heavy car supporting population systems, right? We have been criticizing that for a long time, but now we have the opportunity, we hope, through COVID to say, look, do you really need that compared to the need to provide, to really pay attention to universal health care, which was just passed in Congress. So if we're serious about universal health care, come on, let's really work on that system. It's a government program. So how about reallocating the money to smaller hospitals, maybe in the city, or primary health care, community health workers, training, small-scale health centers, and the like. So reallocating the budget, I think, is one place where we can also help, together with our economist friends who are supportive of this. But I think we have to find our niches, and our niches are basically in the evidence from the marginalized groups whose lives we try to assist. Okay, that's it.